So, last time we talked all about the external threats, the toxins and things from the outside world that can affect a pregnancy. But what happens when the biggest challenges are actually coming from inside the body? Well, today we're going to take a look inside at the complex and honestly fascinating world of internal pregnancy complications. And this quote right here, it's huge. It really sets the stage for everything we're about to cover, because almost everything we discuss today is going to circle right back to this one central idea. A healthy birth weight, it's the launch pad for a healthy life. Okay, so here's our game plan. We're going to start with how sugar affects a baby's size. Then we'll get into the serious risks of high blood pressure. After that, we'll see how blood health directly ties into birth weight. And we'll wrap up with something you might not expect, a look at how a baby's gut gets its start. All right, first up, the sugar and size connection. To really get this, we need to understand a condition I'm sure you've heard of, gestational diabetes. So what exactly is gestational diabetes, or GDM? It's pretty straightforward. It's a type of diabetes that only shows up during pregnancy. The mother isn't diabetic before, but the pregnancy itself triggers it, usually sometime after that 24-week mark. Now here's how it works, and it's a pretty simple two-step process. First, all those powerful pregnancy hormones can actually block the mother's own insulin from doing its job properly. This is called insulin resistance. Because of that, glucose, or sugar, can't get out of her blood as easily. And second, all that extra glucose zips right across the placenta and ends up basically overfeeding the baby. And this is a big deal for both of them. For the baby, all that extra sugar gets stored as fat, which can lead to something called macrosomia. That's the technical term for an excessively high birth weight. And for the mom, GDM doesn't just go away. It puts her at a higher risk for high blood pressure during the pregnancy, and get this, about half of women with GDM go on to develop type 2 diabetes within 10 years. And that risk of high blood pressure, well, that brings us perfectly to our next topic. What happens when that pressure escalates during pregnancy? And, we're not talking about a small number here. Up to 8% of all pregnancies are affected by high blood pressure, and it's a leading cause of maternal death worldwide. So it's absolutely crucial to understand how this condition can progress. This slide does a fantastic job of showing how things can escalate. It often starts as gestational hypertension, just high blood pressure that shows up after 20 weeks. But if it gets worse, it can become preeclampsia. That's when you see other signs of organ stress, like protein spilling into the urine. And the most dangerous, life-threatening stage is eclampsia, which is when seizures begin. And here's a fascinating little detail about that word, eclampsia. It comes from the Greek word eklampsis, which means a sudden flash. It was used to describe the terrifyingly sudden arrival of these seizures, like a lightning bolt out of the blue in a woman who might have seemed fine just moments before. It really captures the severity of it. Okay, so for our third topic, let's circle right back to where we started, birth weight. We're going to look at how the mother's blood health, specifically a condition called anemia, can directly mess with how a baby grows. So, from a clinical perspective, we diagnose maternal anemia when these lab values, hemoglobin or hematocrit, drop below a certain point. But what does that actually mean? It means her blood just can't carry enough oxygen to all of her tissues and, just as importantly, to the baby's tissues. But, and this is super important for a nutrition course, not all anemia during pregnancy is the same. There's what we call physiological anemia. This is kind of normal. It happens because the mother's blood volume expands so much that her red blood cells get a bit diluted. But then there's nutritional anemia, and that's a direct result of not getting enough iron from food to build the hemoglobin in the first place. So why is this such a focus? Because that nutritional anemia is a major cause of low birth weight. A baby is considered LBW if they're born weighing less than 5.5 pounds. And for these tiny infants, the risks are real. They can struggle with feeding, with staying warm, and face a higher risk for developmental delays down the road. And then on the complete opposite end of the scale, you have large for gestational age, or LGA, babies born weighing over 8.8 pounds. And look at that, we've come full circle. The most common cause for LGA? Poorly controlled gestational diabetes, just like we talked about, with all that extra sugar being packed on as fat. Which brings us to our final point, and honestly, this one is pretty fascinating, because the consequences of all these things don't necessarily stop at birth. Let's talk about the microbiome. So, because those LGA babies are so big, a traditional vaginal delivery can be really risky. This means a C-section is often the safest route. And while C-sections are incredible, life-saving procedures, they have this really unexpected side effect for the baby's health. See, a vaginal delivery is like the baby's first inoculation. As they pass through the birth canal, they get coated in a rich community of their mother's beneficial bacteria. This seeds their gut for life. But a baby born by C-section misses that whole experience. Their first dose of microbes comes from the sterile hospital environment, which can set them up for an entirely different and potentially imbalanced gut microbiome from day one. So let's do a quick recap of the big ideas. 1. Gestational diabetes is all about blood sugar, creating risks for both mom and baby. 2. High blood pressure is a spectrum. It can go from mild to deadly. 3. Iron matters. Nutritional anemia is a direct path to low birth weight. And 4. The way a baby enters the world has a massive impact on their gut health for life. We've seen just how profoundly the internal world of the mother shapes a baby's future. The foundation for a healthy life is so clearly laid before birth. But that just leaves us with the next big question, right? How is that foundation built upon in those critical moments, days, and months after birth? Well, we're going to tackle that next time when we dive into the amazing science of lactation.